Two of Tasmania's most powerful health bodies have described cuts to Tasmania's health budget as catastrophic. The organisations representing the state's doctors and nurses have joined forces to pressure the government into quarantining frontline jobs. And they're calling on the government to outline the full extent of the cuts.
The Australian Medical Association and the Nurses Federation stood united outside the state's largest hospital to deliver a grim message.
The situation with respect to health and the budget cuts in Tasmania is actually at the point of being almost catastrophic.
They've accused the state government of underestimating cuts to the health budget. The Health Department has to find $100 million in savings this financial year. The AMA and Nurses Union say that figure could double because hospitals also have to claw back their deficits from previous years.
It now leaves the LGH around $40 million cuts. It now leaves the Royal around $60 million cuts. And this is just a joke. There's no way we can continue providing safe care to the public of Tasmania with these sorts of cuts in the healthcare system.
They've renewed pleas for frontline services to be spared. The AMA says the dermatology and rheumatology registrar positions at the Royal Hobart have already been axed for next year.
We're talking about increased waiting list across all of those specialties at the very least, increased requirement for beds, increased operations required, and we are looking at a disaster.
Both organisations want the state government to reveal the real figure for health cuts.
You can't duck shove this. They're responsible. They need to come clean.
A spokesman for Health Minister Michelle O'Byrne says the government has always maintained the $100 million in cuts was in addition to hospital deficits. The Health Union warns industrial action is likely. Cara Douglas, ABC News.